International Classification of Diseases, 10th revision, clinical modification. That's what that stands for.
Yes.
Okay. I'll be able to remember it now.
Yeah.
Because I had the other part right. I didn't have that clinical modification. Okay.
International Classification of Diseases, 10th revision, clinical modification of diseases. Okay. What does ICD-10 PCS mean? Google it. Use your friend.
Yes, ma'am. The last part I know what that means. That's I know what the first part. Not the I get it. The International Classification of Diseases, 10th revision procedure coding system.
That's right. That's right. Very good. Now, what does CPT mean?
CP, current procedure. That T part, I know it's current procedure CPT. Let me Google it. After I see it now, I'll get it. Current procedure terminology.
Current procedure terminology. Very good. Now, tell me this. I told you only, now let me open this up here while I'm at it before I say anything else. HCPCS. What does that mean? Google it. Excuse me.
The healthcare and procedure coding system.
Now, which 3 books do you use in a physician's office?
Icd-10 Cm CPT. I gave you 2.
I said 3.
SPCS.
Okay.
CPT, HCPCS.
Known as HCPCS. HCPCS. Very good. Now, which 3 books do you use for acute care coding?
Icd-10 Cm, Icd-10 PCS,
and
HCPCS.
That's right. Which of the coding books are used for durable medical equipment or home health?
HCDCS.
Very good. Very good. Very good. Now, let's get to the matching session. Number 1. J1, is that an ICD-10 PCS, an ICD-10 CM, or CPT code?
ICD-10 CM.
Very good. Current procedure terminology. Number 3, B6.10.
Focus on, I don't see that. Let me make my camera.
B.
Call that one out for me, please. Again.
Okay. B as in boy. B6.10.
ICD-10 CM.
You sure? B as in boy.
It's B6.1.
Point 10.
Oh, B as in boy, 0.10.
B6.10.
ICD-10 CM.
No, ma'am.
It's not.
No, ma'am. ICD-10 PCS. I said that the PCS only has two-digit codes for procedure coding, for acute care coding.
PCS only. Repeat that statement for me, please.
Okay, ICD-10 PCS only has 2-digit codes for inpatient procedure coding. And they have their place values if it's going to be a 0.345. But they only come in 2 digits, which is 1 alphabet and 1 number. Point something. 1 alphabet, 1 number. Point something.
1 alphabet.
1 number. And then a point.
Okay, I have a question about that.
Okay.
Because when I was doing some ICD-10 PCS, those codes would have alphabet and their number. Usually were at the most, I think, 7. When I was doing some exercises, PCS exercises.
Okay.
That's why that right there confused me.
Okay.
I mean, but you're saying I'm not correct about it, but I just remember doing some in some of my work, my class work.
Okay.
And what I remember seeing.
And what did your professor say about it?
Oh, all that's online. I was reading that. Well, my professor, you telling me
it starts with
only has 2 digits.
Yes. Code. It only starts with 2 digits. Listen to me carefully, sweetie. It starts with 2 digits. Okay. Alphabet, then a number. Then it's going to tell you if it needs a 3rd or 4th number. That's inpatient procedure code. That's when a patient has gone through surgery on an inpatient basis.
Okay. 4th. Yes, ma'am.
Okay. Now, if it's 7 digits or something like that, you probably got that mixed up with the ICD-10 CM. Now, they start with the first 3 digits, then a period, and then the coding rules will let you know if you need a 4th, a 3rd, 4th, 5th, or 6th of a 7.
Okay.
Got it, Pumpkin? Okay. So
Yes, ma'am.
okay, so again, let's readdress number 3. The code B as in boy 610. B as in boy 610.
Six. It was it like that? Or straight B610.
B6.10.
Yeah, it was. Okay.
And what kind of code is that?
That's ICD-10
10 what?
PCS.
Not ICD-10. ICD-10.
No, I said ICD-10 PCS.
Okay, very good, very good. It takes some getting used to. You'll get it. Number 4, G25.0. G25.0. What kind of code is that?
ICD-10 CM.
Very good. Mm-hmm. Number 5, 34471.
CPT.
Very good. Number 9, P93.
P93.
Point.
You said P93
Point.
ICD-10 CM.
Very good. And last but not least, Q2.3. Q2.3.
ICD-10 CM.
Q2.3.
No, because I have an alphanumeric. No, ICD-10 PCS.
Very good. Very good. Very good. Now, I'm going to cover this up, and we're going to revisit this later on again. Okay?
Okay.
Hold on. All right, so let's look at the ICD-10 CM book. The ICD-10, because you have all 4 books, right?
Yes, ma'am.
Okay. Oh, excuse me. Okay. Now, remember when I said that hold on. Okay. That the ICD-10 CM has 2 volumes. It has 2 volumes. It has volume number 1, and it has volume number 2. We know that volume number 1 is the tabular list. The tabular list. Okay? And we know volume number 2 is the alphabetic list. Right? Don't you take a peek at that. Okay, now, volume 1 is tabular list. Volume 2 is alphabetic list. Which one, if you were going to search for a disease, bacterial vaginitis. Bacterial vaginitis. Okay, so we have the term bacterial vaginitis. What is the condition of that diagnosis? What is the condition of that illness? I want you to pay attention. What is the prefix on vaginitis? What is the prefix? I'm sorry, not prefix, suffix, sorry. What is the suffix? What is the suffix of that word vaginitis?
Would it be vaginitis?
Okay, what is the suffix of that word? The suffix of that word is itis. Itis. I-T-I-S.
Okay, I did say vaginitis then. I did say it right. Okay, that was right then.
Yeah. You said vaginitis. You said vaginitis in whole. I want to know, what does I-T-I-S mean?
Oh, that's
the suffix.
That's
Listen.
the terminology word.
Right.
I'm sorry.
Hold on. The suffix. What I'm asking for in vaginitis, what is the suffix in this whole word? The suffix that I'm asking for is itis.
Itis, okay.
That's the suffix I'm looking for. What does itis mean?
Inflammation.
Inflammation. Inflammation. Okay, so the condition of bacterial vaginitis, that it's an inflammation of the what?
Of the vagina.
Of the vagina. And what's causing that inflammation?
The bacteriosis. Bacterial.
The bacteria. The bacteria. You can leave off AL because AL is a prefix that means pertaining to. AL means pertaining to. Pertaining to what? Pertaining to bacteria. But if the information is inflammation of the vagina pertaining to bacteria. But the main key grip that I want you to understand is the condition. And the condition is inflammation. So when you go into your Icd-10 book, which is your DX. What does DX mean? I told you what DX meant last week. What does DX mean? Diagnosis. Girl, you're going to make an A in my class for it's all said and done. Okay, now, DX means diagnosis. Okay? Now, the condition is inflammation. I need you to find bacterial vaginitis under the condition inflammation. In which volume of the book are you going to start at first? Which one? Volume 1 or 2? 1 or 2? 1 or 2? Which one?
Volume 2.
Volume 2. Very good. So look up in your, I'm going to look up in my Icd-10 book and find inflammation. Once you find inflammation, then I want you to find vaginal, and then we're going to define it more definitive. Is it vaginal bacteria? Is it vaginal strepto? Is it vaginal Aureococcus? I mean, I need you to be, you're going to define it first by the major condition. Then you're going to streamline it down the vagina. Then you're going to streamline it one more indentation over, and you're going to look up, is it Aureococcal? Is it bacterial? Or is it streptococcal? I mean, which is it? You understand, Sweet Pea?
Yes, ma'am.
Okay, very good. Now let me get my book and let me look onto this with you. Okay. Ooh, this book is heavy. Oh.
Yes, ma'am, they are.
Oh my goodness. Oh my goodness, this book is heavy. Okay. Miss Harper gonna look right along with you, Sweet Pea. And remember, if you don't find it there, the ICD-10 book will never lead you wrong. It's gonna give you a breadcrumb and say, see this word, or see this condition, or see that condition. It's gonna give you breadcrumbs. Because it already knows when the WHO Foundation wrote this beautiful book here, World Health Organization. Well, this is 2018. This is a little old, but I still use it for teaching purposes. Jesus, what was I saying? They know how you're gonna think. They already know if you're gonna look in one place, they're gonna think about looking at it in one place, and that we're gonna tell them how to breadcrumb their way to the next place. But you got to know how to use your book. So yes, we are going into volume 2 first. I know you're saying, Ms. Harper, why do they have volume 2 in the front and volume 1 in the back? I'm glad you asked. I did not write the book. I just learned the coding rules and how to find it and find what I need. And then I teach it to everybody else. Okay, now, tonight I didn't hear you talk to me, baby. Okay.
We went to inflammation.
All right.
Once I went to the word inflammation, I looked till I found vagina.
All right.
And there it has a message for me that says, see vaginitis.
See that breadcrumb right there? I tell you, they were smart when they made this book. All right, so let's go to vaginitis. Let's go to vaginitis. Did you see the word vaginitis?
I'm still looking for it. I'm turning to it now.
Okay, Sweet Pea. Let me know when you find it.
Okay, I'm there now.
Okay, and what does it say?
Vaginitis, acute, I want to make sure I pronounce that right. Is that circumscribed?
Circumscribed.
Circumscribed, okay.
Circumscribed.
Diffuse, emphysematosis.
Okay, emphysematosis.
Okay.
Non-venereal. Right.
Ulcerative.
Right. Now, remember what I told you. Let me call down to my husband because I hear my oven going off and I know he's asleep. Give me a minute.
Okay, no, that's fine.
He wants to cook, but Lord, baby, you got to pay attention. You can't cook and go lay down.
No, ma'am, can't do that.
Bless his heart, he's trying. He's trying. I ain't mad at him. Baby! Joe! Buddy! Buddy! Don't you hear the oven? In the kitchen, Bobby Joe, that's all the oven we got. Press the off button for a timer, Bobby Joe. Okay, press cancel. Okay, sweetie. I'm sorry about that. Okay. So, are you there tonight?
Yes, ma'am, I'm here.
Okay. So, when you find the word vaginitis, and you see a bunch of cute little words written in parentheses, they all mean the same of vaginitis. If the doctor on the soap note or on the checkout sheet, the encounter sheet puts acute vaginitis, that's still going to be N76.0. If he says diffuse vaginitis, it's still going to mean N76.0. If he put emphysematous vaginitis, it's still going to mean, it's going to be what? Tonight?
N76.0. N76.0.
Thank you, ma'am. It's still going to be there. Now, we found the main term. So now you see how we're going to define it a little bit finer. So it's going to indent a little bit to the right. Do you see that?
Yes, ma'am.
Okay. Now, the next one you should see, the next indented line you should see is with ectopic or molar pregnancy. Do you see that in your book?
Yes, ma'am.
The next one you should see is amoebic. Do you see that?
Yes, ma'am.
Okay, so all those words that are lined up on each other like that, that's the next indentation. That's the next fine, definitive, as fine as you can try to get. Every time it gets fine, then if it gets to where it's on your word, then we got to scoop over. You may have to, may not, scoop over and define another line of words, okay? So it's going to keep indenting to the best specificity. Do you understand that, Precious?
Yes, ma'am.
Okay. So now keep coming down till we get, see how all these words are in alphabetic order? Amoebic, atrophic. There's our word. Do you see it?
To my bacterial?
Yes. So it's vaginitis pertaining to what?
Bacterial.
Bacterial. So we found our definitive, our best specified diagnosis. So now we're going to use that code. Although the code is the same as the one in the beginning, don't always take that for granted. You still got to try to find the best specified code. You got that, Pumpkin?
Yes, ma'am.
Okay. Now, N76.0. Now, let's go to which volume to find that.
Volume 1 in the tabular list.
Girl, you're going to get an A when you get through with my class. I'm telling you, you just all up on this like peanut butter and jelly. Come on here. Okay. All right. All right, sweet love. Now, we're going in volume 1 to verify. We got to make sure of the code that we found in volume 2 is telling the definitive truth in volume 1. Okay?
Yes, ma'am.
All right. So now, in 76.0, what chapter is in? N is speaking of a specific anatomy or anatomic chapter. What chapter is that?
Talking about where I'm at located right now?
Uh-huh. How many chapters did volume 1 have?
Several chapters, but you need
several. That's broad. Okay, but I need something a little bit more specific. I said that last week.
21.
21. That's right, because I said that last week.
21 chapters.
Told you I'm gonna give you a quiz.
Yes, ma'am. I'm getting it.
All right, sweet love. So now we're in a chapter that has all the codes that begin with N. Okay? And that chapter is chapter 14. Chapter 14 talks about diseases of the urinary system. Diseases of the urinary system. Okay? That's male and female reproductive and the urinary system. 3 things. Male and female, we both have urinary systems, but our urinary systems are a little bit different. Men have bladders and prostates. Women, we have uterus and bladders. Understand?
Yes, ma'am.
Okay. Now, we in the alphabet letter that's pertaining to the urinary system. And what did I say the urinary system consists of? What 2 folks and what 1 thing that we got in common? What did I say?
Repeat that question for me again.
Okay. What system of the body does chapter 14 in the Icd-10 Cm Book deal with?
14.
It deals with the urinary system. The urinary system consists of male and female organs, and it consists of the urinary system. Male and female organs, and it consists of the urinary system. Those are three things that the urinary system deals with.
Okay.
Okay? All right. So Ian should tell you, this person's disease is in chapter 14. Okay. Now, the next alphabet behind it, the first number behind the N is a 7. Now let's find 7. We got 90, we got 91, we got 93, we got 96, we got 9. Okay, it's kind of thin right there. Okay, so 97 category that deals with the female reproductive system. Okay, so we have 9, which is the urinary system. 7, the female reproductive system. Now we got to find 6. We need to find 6. 976 is other inflammation of vagina and vulva. The vulva is the outer lip of the vagina. Okay? Now, in your book, do you see 976 with a red dot in front of it?
Am I still in the tabular list?
Yes, ma'am. You still should be in chapter 14, where everything in chapter 14 begins with an N. Let me know if you're there in chapter 14.
I'm there, and now I'm going to look for the code that we're on. Back to
yes. So you're going to go code N1, N2, N3, 4, 5, 6, 7. Turn one page at a time. Take your time.
Okay. N76.
Do you see it?
Yes, ma'am.
Does it have a red dot in front of it?
Yes, ma'am. Meaning 4th character.
Yes. A 4th character is needed. Now, this says 976. That's 1, 2, 3 digits. Icd-10 Cm diagnosis code is going to always have 1, 2, 3 digits in the beginning, then a dot. Now, what we found in volume 2, it says 0.0. So again, you see how it starts off with 976 and then it indents over to 976.0?
Yes, ma'am.
Okay. All right. So now this says acute vaginitis. Then this one says subacute and chronic vaginitis. Okay. Hold on, sweetie. This says acute vaginitis, subacute. Okay, we're going to keep reading and looking until we find a little bit exactly of what we're looking for. Because we don't necessarily see the word bacterial. So 976 stops at 976.6. When you go 976.8, that begins a whole different genre of other bacterial informations. Okay? So our closest best specificity or best specified code is going to be 976.0, which includes vaginitis, not otherwise specified. Do you see an NOS there? Sweetie, are you there?
I'm trying. You said N76.0.
0.
Okay, yes.
0.
Ma'am.
Okay, it says.
Vaginitis.
Okay, now come and dent over and look at the next three set of words. This says acute vulvovaginitis, so it doesn't mention anything about vulvo. Acute, this says right here, vaginitis, NOS. Do you see NOS?
Yes, ma'am.
Not otherwise specified. Now, that is a coding note, if you will, to speak of some codes that all encompasses vaginitis. It's not going to specify all that. It's just going to cover all of that. That's why it says NOS, not otherwise specified. It's a blanket diagnosis is to say, yes, use this code. We don't see bacterial. However, when we did find bacterial and we found it under vaginitis, and it led us to N76.0, and then we had to look for it under volume 1 to verify it, and it led us to 976.0. It speaks right to vaginitis, not otherwise specified. That means it can cover bacterial vaginitis. It's a broad way of saying yes. It's not specified to one thing. It's specified to all things that's pertaining to vaginitis. Are you understanding that, sweetie?
Yes, ma'am.
Okay, now tell me what I said. Tell me what you think I said.
You said a lot, Miss Harper.
Okay. All right. But do you understand what I mean? That's why I wanted to YouTube record this so you could look at this over and over and get this in your marinate this on your mind. And
yes,
you'll have your aha moment. Oh, that's what Miss Harper said. Oh, that's what Miss Harper means. Yeah, it'll kick in. It may not kick in right now to make sense, but if you keep looking at the video, it's going to kick in. Okay? You're new to this. I understand. Okay, Pumpkin?
Yes, ma'am.
Okay, very good. Now, let's look up, let me find another diagnosis word. Okay, let's look up. I'm going to put in another sheet. Give me a minute. Okay. Hold on just a minute, sweetie. Hold on. Okay, so now I'm about to write you a bunch of stuff up here. Okay. Okay. First term I want you to find is breast cancer. Breast cancer. Now, another term to look up breast cancer is neoplasm. Neoplasm. Okay?
And what I'm doing is finding all the ICD-10 codes, CM codes. Okay.
Yes. Okay.
All right.
Now, that one says, now I want you to go back to volume 2, and I want you to find a section that says tables of neoplasm. I'm going to kind of educate you on this a bit. Mm-hmm.
Okay, we'll start with the first one.
Okay.
Breast cancer, neoplasm. You want me to
find the you're under the condition neoplasm. You're under the condition neoplasm. Neoplasm means cancer. Now you got to find the word breast.
Okay. So I'm gonna go to my index and notice that it's not there.
Okay, wait. You still under the table of neoplasms, right?
I haven't gotten there yet. My book a little bit different, so I'm just
yeah, that's right. Your book is different. Okay, find the table of neoplasms.
Okay, the second section in my book is neoplasm after index. So I'm just talking you through to get to it.
Okay, now within the index of neoplasms, alphabetically find the word breast.
Okay, we're going to look for the word breast. Okay, I found the word breast.
Okay. Now, again, it has the same thing. It has words next to it in parentheses. It has the same thing. Word next to it in parentheses. You have connective tissue. You have glandular tissue. You have soft parts. Now, it broadly says breast cancer. It doesn't say what type. It doesn't say soft tissue breast cancer or connective tissue breast cancer or breast cancer of the nipple or of the areola. It just says broadly, it says breast cancer. Now, we're going to go with the first line that we see. Okay? Now, do you see how things, I don't know how it looks in your book, but it should give you like a line where it says malignant primary, malignant secondary, cancer in situ, benign, uncertain behavior, or unspecified behavior. Do you see anything like that?
Yes, ma'am, I have all that.
Okay. So if your book is somewhat or the same like my book, then you should go breast cancer this way and see what column does it fit in. What column does it fit in? So it didn't say primary. We're not going to assume primary because the doctor didn't say primary. The doctor said breast cancer. We're not going to say malignant secondary. The doctor just wrote breast cancer. We're not going to say cancer in situ, meaning cancer started here, but it traveled elsewhere, okay, or started somewhere else elsewhere. That's what in situ means. So it just plainly says breast cancer. It didn't say benign because benign is the opposite of cancerous. Benign means non-cancerous. They found a tumor in the breast, but when they did the fine needle biopsy and the testing, they realized that it was just a benign tumor. It wasn't cancerous. Okay. But from my experience, they'll do a fine needle biopsy and an ultrasound to make sure what they see is what it is. Okay. Now, do you see a line that says uncertain behavior? Do you see that?
Yes, ma'am.
Okay. Now, bring that all the way down to match your word breast.
Okay, and I have it.
Okay, what is your code that you got?
D48.6, and I have a check by it, which I think that means that I need to add an extra
character.
I was trying to find a correct word to say.
You got it. Very good. So let me write this on here. This says D48.6, and it has a red dot by it on this side in volume 2. But now, just like we found it here in the table of neoplasms, we still got to verify it in volume 1.
Correct.
Okay, so let's go to the, what is it? Is it alphabetic or tabular list?
Tabular list is where we're going.
That's right, ma'am. You're going to make an A in my class by the time you finish. And what chapter is D in?
It's on the Neoplasm, which is chapter 2.
Mm-hmm.
D48.6.
Mm-hmm.
And it tells me that neoplasm of uncertain behavior or breast. I need a 5th digit is what I have to have.
Very good, girl. Girl, you gonna make an A in my class before you finish. Okay, now look, and you got to kind of skip an indentation over. You see a bunch of these diagnosis codes that are 5 digits?
Yes, ma'am.
All right. So this one says neoplasm of uncertain behavior of unspecified breast. That's 48.60. The next one says D4861 neoplasm of uncertain behavior of right breast. Okay. Did the doctor write up here right breast?
No, it doesn't say right breast. No.
Okay. Here's the next one. D48.62 neoplasm, uncertain behavior of the left breast. Did the doctor write anywhere on here about a left breast?
No, ma'am.
Okay. So what is your best specified code? What is the code that speaks to the best specificity of that term, of that diagnosis?
It will be the D48.60. That's neoplasm of uncertain behavior of unspecified breast.
Very good. Now you understand it. Now you understand it. You're starting to understand the formalities of coding and what all it entails. Okay. Now let's take a look at this one. Right foot digit toe injury. Right foot digit toe injury. What is the condition? What is the condition of this person's right foot toe
injury?
Let's go look under here.
So we're going to on the index, and we're going to look for.
We're going to find it. What chapter? What volume we going back to? 2. Okay. So we're going back to volume 2, and we're going to find it under what?
Injury.
Okay.
That's injury.
That's a condition.
Okay, so I have the word injury, which it has a lot, and we got to find right foot digit.
Yes. But most importantly, you have to find not right foot. You got to find foot first.
Foot first.
Foot first. Then digital toe. Then make sure if it says right or left.
Okay, so I found right injury foot.
Hold on. You found right injury foot, or did you find foot?
Oh, no, not right. Foot.
You found foot.
But we have to do specified and look for right. Now, under here, I don't see, okay, dorsal artery vein laceration, plantar artery injury, specified.
Okay, so this says foot. Now, the closest thing on here would be Okay, it says superficial. See, injury, superficial foot. The superficial is on top, but we want to look up foot. Okay. Digital. Okay. Let's look up. We see foot. Let's look at toe. Let's take a look at toe. Injury to toe. So toe is, if you go under injury, you see toe, it says S99.92. If I look under foot, it says S99.92. So S99.2 speaks in both categories. It speaks the same thing.
Okay, repeat that. What you S99?
See, if I go up under injury and I find the word foot, I found the word foot.
Okay, you said S99.92.
92.
Okay, so I was right.
And then if I look over here and I see the word toe under injury, it also says S99.2. Do you see that, Pumpkin?
I'm looking for the toe. Okay.
You under injury? You still under injury?
Yes, ma'am. So it's just the S99.92
for both of them. For both of them.
Okay.
It speaks the same for both of them.
Right foot, digital toe.
Right. So we're going to go and search under S99.92. And it has a red dot right by it. So what chapter is S in?
Chapter 19, injury, poison, and certain other consequences of external causes.
Okay, very good.
S99.92. Unspecified injury of foot, but it's asking for a 6 digit. My book is.
Yes. Hold on, I'm getting there. Give me a minute. Okay, S99.92. Okay, unspecified foot injury or injury of foot. Now, this has 921. It says unspecified injury of right foot. Then it has left foot and then unspecified foot. Okay, so do you see those boxes in front of you?
Yes, ma'am.
Okay, that's the box you want to use in front on top. Okay, now is this the first encounter? Is this a subsequent encounter, meaning second? Or is this sequela, meaning continuous?
Okay, from what my...
So here we go. Here we go. If the doctor wrote right foot digit toe injury, we have to assume by this example, okay? Because normally in SOAP notes, you as a coder, you're going to see, is this his second visit? Is this his third visit? You're going to be able to see that in the note. Because when the nurse comes in and speaks to the patient, she's going to speak to the patient and she's going to write down, oh, the patient is coming in for a follow-up of his injured right toe. Or the patient is coming in for a third follow-up or something like that. A follow-up for the last follow-up because the doctor had him to do x-rays to see how he's progressing. You're going to know by reading the chart. However, by example of this, we're assuming that the doctor is seeing his patient on the first encounter, on the initial encounter. This is the first time the patient is seeing the doctor for this issue. Okay?
Yes, ma'am. I'm with you on that.
Okay. Okay.
I'm listening.
Yes, ma'am. Okay. So the only time you'll be able to differentiate if it's going to be initial, subsequent, or sequela is you have to read the notes in the SOAP notes of the chart to know how to properly code that. Okay. So now our code is going to be S9911. Is that what you have in your? No, I'm sorry. S99921. Okay, so we have how many digits up here? 1, 2, 3, 4, 5, 6. We need an anchor code right here. And the code is going to be what? A.
A is an apple.
A is an apple.
That is the initial encounter.
Yes. So when you send it in to the insurance company, we're going to know this is the first time. And then I'll tell you how the insurance company is going to respond back to the patient, respond back to the doctor. Is this an injury due to work? Is this an injury due to an auto accident? Is this an injury due to a commercial accident, meaning in Walmart or dealers? Did it happen on somebody's property? Did it happen in somebody's house, somebody's apartment or townhome? It's going to ask those questions. And then that's where you submit the electronic medical record notes. That's where you submit the SOAP notes from that date of service. Does that make sense, sweetheart? That's why it's important on the CMS 1500 form or on the electronic form, and I forgot there's another name for it. Box 12, 13, and 20, I think it's 27. Box 12, 13, and 27 are very important boxes to check off and to have the patient to sign. Now, when the patient does the initial paperwork of the office, it's going to already state in the paperwork, do you give Dr. So-and-so permission to send copies of your medical records as requested if needed? The patient have already signed their name, yes. So all the medical biller has to do is say SOF, signature on file. Okay?
Okay.
That's on box 12. That speaks of electronic medical records. Box 13. Does or do the provider have a right to accept monies collected from the insurance company? Amidst of all that beautiful paperwork, the patient has already signed their name and said, yes, Dr. Hancock has permission to receive all monies from the insurance company that's due to him for whatever services is rendered to me. All they got to put on line 13 is SOF, signature on file. Box 27 is very important. Box 27 says assignment of benefits. So you, as the medical biller or medical biller and coder, must make sure that box 27 is assigned yes to receive assignment of benefits. If you do not sign box 27, guess where that pretty little paycheck gonna go? To the patient's house.
Okay.
Even though you signed box 13, signature on file that the patient says, yes, pay Dr. Hancock. But you as the medical biller, you did not check off yes in box 27 to says assignment of benefits. You did not do that. Guess where that check going? To that patient's house. And that patient gonna get that check in the mail. They're gonna get that check in the mail. And they're gonna say, oh, Blue Cross Blue Shield sent me something. Oh my goodness. They sent me a check. Oh, I feel so blessed. Oh my goodness. They sent me a check. Oh, how fortunate of me. That's some good insurance. And then you wondering why you getting a $150 bill from Dr. Hancock office. And then you're saying, insurance did not pay. What you mean the insurance did not pay? Hold up. You the patient. You calling. What you mean the insurance did not pay? They didn't pay us, but they said they paid out a check for $100. Oh, that's what that check was? Oh, ma'am, did you get a check from Blue Cross Blue Shield? Yes, I did. Well, ma'am, what did you do with that check? I cashed it and put it in my bank. I thought it was for me. No, ma'am, I'm sorry. So since you cashed it and kept it and put it in your bank, we're going to bill you for that whole $150 because you could have been just paying maybe less than $25 residual payment because your co-payment is $25 and the insurance would have paid us $100. So you're gonna pay the whole thing now. I'm so sorry. Then well, it's not my fault. Okay. And it's really not the patient's fault. Then the patient has the right to get mad and counteract your anger. Well, how do I know that I'm supposed to get this? And you know what? The billing manager of the office, she gonna look at every EOB, every little pretty EOB that come in from the insurance company, and she gonna audit. Okay, we didn't get paid. Why we didn't get paid? Hold up, this money went to the patient. TT, I need you to explain to me why this went to the patient. Did the patient pay this in full already, or what? Oh, I forgot to check the assignment of benefits. You forgot to. So guess what? You gonna get on the phone and you gonna call that patient and explain yourself, and you gonna kindly ask them to pay that $100 back. Okay? So to keep you from hearing bitter chatter from the patient because of your boo-boo, please pay attention to details. Billing and coding is just not about sitting at a desk being cute. No, ma'am. You got to pay attention. Huh?
It's a lot of reading.
And paying attention to details.
Detail.
Paying attention to details. You don't pay attention to the details, you're gonna mess somebody up. You and your office up. And when y'all have that pretty end of the month meeting to see where y'all forecast of your money is, and we got to give reason for why TT didn't do her job correctly, and we missing $10,000 this month, you're gonna have to account for that. And they ain't gonna take it out your check. They're just gonna put you on serious watch. That's called micromanaging. And if you still messing up, then they're gonna put that pin in your life. It's called a verbal warning. Then a second verbal warning. Girl, you ain't getting this. Guess what? Sweetie, I'm sorry, it's 5 o'clock. We're gonna have to let you go. It's been nice working with you. Okay? So it's not to scare you or frighten you. It's to tell you how important codes are and how important you have to hey NC worker. I see somebody on my chat. Say something back to NC worker. It's very important that you pay attention to detail. Okay, Pumpkin?
Yes, ma'am.
All right. Now, let's look at the next code. Now, I don't mean to confuse this, so let me kind of line that out. And do this like this so we don't get it confused. Okay, the next one is bursitis. Bursitis. What is the condition of bursitis? What is the what is the suffix? What is the suffix on bursitis? What is the suffix term? Itis. Itis. Itis means what?
Inflammation.
Inflammation is the condition of the patient. Yes or no?
Yes, ma'am.
It's condition of the patient pertaining to their what? Bursa. Bursa. Okay, that's in their knee. Okay. Here she said, I'm new here. Do you offer classes for certifications? Ooh. Okay. All right. Hold on, I'm responding. Oops. Okay. Bursitis. So where are we going back to find bursitis? What is the first volume?
Itis, which means inflammation. So
what volume?
Two. Sorry.
Volume 2. Okay, ma'am. All right. You got it.
All right. So going in the index, and we're going to look for the term inflammation.
Very good. Come on. You're going to make an AMI class in no time.
And then we're going to search for a bursa.
Uh-huh. Okay, now we don't see
Bursa.
Do you see it?
No, ma'am.
Okay. So let's look up the term itself, bursitis. If it's not there under the B word, B-U-R, then we got to rethink the intentions of the name. And we know that the bursa, when you learn it, if you haven't learned it already, is dealing with the knee.
So we will go in the index to the B's.
Yes,
we'll
ma'am.
Look for the term bursitis. And we have a code.
Okay, hold on. Okay. Very good. Okay, so we had to find it under its own condition name. Okay, so we have bursitis. What code do you have in your book?
M71.9.
Okay, very good. Okay, so now it doesn't say knee, but it is located in the knee. But let's stay with the generalized fact that the doctor said the diagnosis is bursitis. Okay, so we're not going to deviate from that. So let's go to M71.9. What chapter are we going to find that in?
We need to go to volume 1, which is the tabular list now.
Mm-hmm. And what is the alphabet?
B. It's going to be.
What alphabet? Where's the code? M71.9. Okay, what alphabet are we going under?
We're going to the in the tabular list under the M's.
Okay, very good. And when you find the M's, tell me what chapter that is.
M is chapter 13, which is disease of the musculoskeletal system and connective tissue.
Very good. Very good. Now, it says M, first digit, 7. Let's look at 7. So we in the M0s, M1s, M2s, M4s, M6. M7. M7 what? 1.
M71.
M71. Okay, I got M71.44. I got M71.9.
Okay, M71.9.
Yes. There it is. Go ahead.
Is it bursopathy? Unspecified.
Okay.
And under that it says bursitis, NOS.
NOS means what?
Non-other specified.
Very good. Not otherwise specified. Very good. I mean, it's broad. You can use that. Okay. So N71.9 is our correct code that we verified. We verified in volume 1. We never take anything at face value. We never take anything at face value in volume 2. We always want to verify in volume 1. Okay? That is the golden rule. Okay, you're doing good, girl. I am proud of you. You are doing so good. Yes. Okay, let's look at nosebleed. Nosebleed. Let's circle this off. And let's look at nosebleed. 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 Okay.
We will go to the alphabetical list and we're going to look for bleed.
Very good. Yes. Yes. That is the condition. Bleed. Bleeding of the what?
Nose.
Very good. Okay, ma'am. You're going to get an A in my class in no time. And then what we do if we'll keep going and then we'll kind of start off in CPT codes, okay?
Okay. In my book, I looked for bleed. I didn't find bleed, but I'm looking at bleeding.
Okay. Hold on just a minute. Okay. Okay, so we have bleeding. Bleeding also means hemorrhage. Okay.
Yes, ma'am. That's what I have too.
Okay, very good. Okay, so we could use the word bleeding and come down and find the most specified area of what it's saying the bleeding is from.
And I found the word nose.
Okay. And what's that code?
R04.0.
Okay.
Okay. Now we need to verify it in the tabular list.
Yes. Yes. Yes.
And so we're going to go under R's.
Very good. And what chapter is R?
R is the symptoms, signs, and abnormal clinical and laboratory findings.
Okay.
Okay. This should be in the front.
Okay.
R04.
All right.
0.0.
All right.
Which is calling it a different name.
Epistasis. Epistasis.
Pronounce it again.
Epistasis.
Epistasis.
Epistasis. Mm-hmm.
And under there it has hemorrhage from nosebleeds.
Very good. Now, although it says R04 and it needs a fourth digit, so the 0 behind the 4 is our fourth digit.
That is correct.
Mm-hmm. Oh. Talk back to me, girl. That's what I'm talking about. That's what I'm talking about. She said to me, that is correct. I like that. All right. All right. Now, the last diagnosis we're going to find for the night. Then we're going to move on to CPT.
Okay. We're doing pink eye.
Mm-hmm. Now, we can try to find pink, or we may have to Google a better terminology for pink eye.
Okay. Index. Let's see.
Go under the word pink. Go under the word pink.
I have pink.
All right. Now it's giving
And I
you
have
some.
the word eye, but it has other terms after it.
Okay.
See, conjunctivitis, acute,
mucopurulent.
Purulent. Okay.
So conjunctivitis. We have to go under the word itself. It's telling you to go under the word itself, conjunctivitis, then acute, and then mucopurulent. So let's find the word conjunctivitis of the word itself.
All right, I see the term conjunctivitis.
Okay. Then it told you to look for acute.
We have an acute code.
Okay. Now indent over and be a little bit more specific. Come down. Remember it said that term mucopurulent?
That's correct.
Okay.
And I found that term.
Okay. So it's gotten a little bit more specific. It went from conjunctivitis to acute, and then from acute shift over. It also mentioned mucopurulent. Mucopurulent is saying mucus out of the eye.
Okay. Our code is H10.02.
Okay.
We are going to need a 5th digit.
Very good. Okay, call that out to me one more time.
H10.02.
Okay, so it still needs a 1, 2, 3, 4, 5, 6 digit. It needs a 6 digit. Okay, so let's go and find the H's. What chapter is H in?
We're going to the volume 1, the tabular list.
Okay, H.
Under H's.
Okay, H1. That's chapter 7. What is chapter 7 dealing with?
Diseases of the eye and
Indexa.
Indexa.
H 10. I had to keep looking back.
That's correct. H10.02.
Okay, do you see it, Pumpkin?
Yes, ma'am. And we gotta have a 6 digit.
Okay. Now you tell me which 6 digit would you code this with, considering the fact it says pink eye and nothing else?
It would be H10.029.
to H10. Right. Exactly. It would be a 9 at the end. That's right. Because why did you choose the one with the 9 at the end?
Because it's unspecified. The other ones was dealing more with the right, left, and bilateral, which is both.
Yes.
And our note did not tell us that, so.
Right.
We have to go by the doctor's notes.
Right. Right. And we have to assume that he's speaking of one eye, maybe two eye, but we got to use the broad one that says unspecified. Now, if the patient comes back in for a follow-up and he says in his notes, oh, the patient has right eye, you can use a more specified and say right eye. Okay. Okay, very good. And I think you got it down now. So you pretty much have it down. There is a chapter in your book dealing with in volume 2 that deals with hold on, I'm going to tell you that in a minute. That deals with external causes and injuries. Say like a person has an auto accident, a person fell off their motorcycle, a person got struck by lightning, a person fell off their trapeze or fell off of a what you call that with the kids bounce on? Trampoline. Yeah. All those would be under external cause of injury index in volume 2. Then you have the table of drugs and chemicals. The table of drugs and chemicals, and we'll entertain some more diagnoses related to that. But the table of drugs and chemicals deal with a person that may have poisoned themselves accidentally by knowing, okay, you just took your prescription about 15 minutes ago when you were in your car before you came into the restaurant. Then you socializing with your friends, and now you asking for a glass of champagne or a glass of wine. You're drinking that after you done had your medication 15 minutes ago in the car. You have accidentally poisoned yourself. Okay? Now, those kind of codes are listed in there. Or a person could have a contraindication of drugs, meaning I took this drug and I took that drug, but I didn't know they were going to contraindicate and react this way on me. And you have to let your doctor know, and the doctor will let the pharmacist know. So from now on, the pharmacist, if they haven't already known to do that, most pharmacists are smart to do that. They'll tell you this drug contraindicates with C blah, blah, blah on your prescription pill. Or they may give you a handout sheet and do a consult with you and tell you, don't take this pill with grapefruit juice or orange juice because it'll dissolve and rid the pill, the effectiveness of the pill, or something to that nature. A person can misuse their medication. Some medications are meant to take in the evening. Some medications are meant to be used during the day. They have those kind of codes for that too. A person that commits suicide, a person that drinks Clorox, all that kind of stuff. You have all those kind of codes inside these 2 chapters that we did not get a chance to talk about in volume 2. Okay, but we'll revisit that another time. Okay. Okay. All right. Very good. Give yourself a hand. You have mastered ICD-10 Cm. You have mastered that now. And if I would give you a certificate of mastery. You have mastered that. But I want to go over some more things with you, like the coding guideline rules and stuff like that. I want to go over some more with you. Okay. All right. So let's pull out our CPT book. I'm going to show you what that is. I'm going to show you what that is. Okay. Your CPT book, current procedural terminology. I know this is 2018 is old, but I use this for teaching purposes, okay?
Okay, that's fine.
Okay. Now, this is for outpatient coding only. Outpatient coding only. And outpatient coding from a physician office or ambulatory office or surgical facility, anything that's outpatient, a radiology, a standalone radiology center or a standalone laboratory center, this is what that CPT book is for. You never use this CPT book for acute care coding. That's not what you use this for, unless the patient is receiving in-house occupational therapy or speech therapy or physical therapy. Then that's when you use the CPT book for that on an inpatient basis. But if it's anything dealing with procedures going under the knife and anesthesia, you're going to use the Icd-10 Cm PCS book for that. Anything for going under the knife with anesthesia, those procedure codes come from the Icd-10 PCS book. If the patient is having physical therapy, speech therapy, occupational therapy, radiation therapy, you have to use the CPT book. Even though they in-house inpatient and still may be there for 30 days, you still have to use this for the ancillary allied health. There you go, allied health. That's who they are, allied health. These are people that do radiology, physical therapy, respiratory therapy. All that is allied health. Okay. All right. Let me put a new sheet up here. Give me just a minute. I'm running out of sheets. I need to get me some more sheets. It's my last sheet, so I got to go get some more sheets, sweetheart, okay? I'll get that this week. I'm just letting you know this is going to be my last little lesson for the night. Oh. Oh, I just not sticking. Oh, okay, this one is back. Okay. 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 All right. CPT. Let's talk about CPT. Let's talk about that. Okay, sweetheart. Current procedural terminology. Current procedural terminology. CPT. Okay? CPT, they have 5 digits. Okay? 1, 2, 3, 4, 5. They do not have any alphabets in them. They only have numbers. They only have numbers. Okay? And the CPT book is broken up by categories. Okay? Categories. So they're broken up by categories, and then subcategories. Okay, glorious. Okay. Okay. Now, the current procedural terminology only deal with PX codes. PX codes. What did I say the abbreviation of PX is?
Procedure.
Procedure. They only deal with PX, procedure codes. Okay? All right. So we're going to open up the front page of our book. And again, each category of every book has its guidelines, its coding guidelines. And we're going to spend 1 or 2 days going over coding guidelines, okay? So we have evaluation and management. This is known as E&M codes. E&M codes. Okay? Evaluation and management. Okay? These are dealing with office visits. And care. Different types of care. Okay? Then, after we have the E&M codes, we then have the anesthesia codes. Anesthesia codes. We have the anesthesia codes. And within the anesthesia codes, we have what we call the P modifiers. Okay? P modifiers. Okay? Now, after the anesthesia code, we have the surgery codes. Okay? Surgery codes are huge. Surgery with a Y. Surgery. And then codes. Surgery codes. Okay? Then we have surgery codes has its very own subcategories. And we'll talk about that. It has its very own subcategories. Okay, now, hold on, sweetheart. Cardiovascular, digestive, urinary, Okay. Okay, then we have the radiology codes. Okay, then after the radiology codes, then we have the pathology codes. Then after the pathology codes, we have the medicine codes. Now, I'm not talking about medicine codes as far as pharmacies per se. I'm speaking of medicine codes as far as vaccinations, like what we're dealing with in today's time. Everybody's getting the COVID vaccination. That vaccination is listed in the Cpt Book for the year 2021. Okay? Now, there is something I forgot to mention, and we're going to put that on the next tape when I have some more paper to write on, Jesus. Okay. Every CPT book, every CPT book, Icd-10 Cm Book, Icd-10 PCS Book, and HCPT Book, they always come out November 1st of whatever year that is. So now everybody should have as of November 1st, 2020, should have gotten a 2021 edition of books. Now, if your school, whatever time you joined your school, if you joined your school well before November 2020 or maybe October 2020, then more than likely you got the books of the year 2020, okay? And that's okay. That's your school book, okay? But when you go out there in the real world, any hospital, any doctor's office, that is part of their acumen of pay, of benefit, is to purchase for the office, not just for you, but to purchase for the office for everybody to use a 2021 edition of all four books that I mentioned. Icd-10 Cm, Icd-10 PCS. Well, if you're going to be doing inpatient, but you don't really need a PCS book for the doctor's office. But however, you will need it for the hospital. A HCPT book and a CPT book. They all should be dated 2021. Come October 30th of this year. Now let's say, for example, October 31st, 2021. The 2021 book will expire. Okay? This right here, come November 1st, should come the 2022 book, November 1st. Okay? So every November 1st of the year is the new published book for that following year. So you can still use, if you all have joined school maybe in October and they got you a fresh copy or early copy of the 2021, bless you. Those that joined school in November, maybe even December, and you got a 2021 set of books, bless you. Just know October 31st, Halloween, at 11:59 at night, those books are no longer invalid. Now, you can go out and buy those books if you want to. That's perfectly fine. Just make sure you put your name on them. See how I put my name on mine? When I buy my books, this mine, Harper. Harper, you can't go wrong. You can't tell me this your book. Baby, you're lying. This is my book. Okay? I just want to make y'all laugh. I'm sorry. But that's how we did in college. Every book we bought, we put our last name at the bottom and we put our first name at the top. I didn't have to worry about that because everybody knows Miss Harper. And if you got Miss Harper's book, you in trouble. Either I let you borrow it or take it home or something. But I didn't give it to you for you to keep. I said borrow because I like my books. Okay, so please understand that. Now, let's go back over the categories of each category for the CPT book. We said E&M codes. That's for what? Office visits and care. You may have a nurse to do a home health visit. I'm a dialysis patient. So I'm going to have my dialysis nurse come out and she's going to charge me for 5 hours, maybe 6. Okay? Anesthesia. If I'm going under the knife, I need a P1 modifier. Am I sickly? Do I have too much disease? Am I healthy? Am I a dead patient? Am I a dead patient on reserve to give an organ transplant to somebody? Those P modifiers are going to tell you something. when we come back on next week, we definitely gonna be talking about POS. POS means place of service. POS, place of service codes. We're gonna that's a C. We're gonna talk about different modifiers. Okay, hope I spelled that right. Different modifiers. We're gonna talk about how to the symbols. That's right, the symbols and everything. We're gonna learn how to find our procedures in the index. The index is in the back. You find the procedures in the index in the back of the book. It's kind of like you doing Icd-10 Cm. Then you go back to the front of the book to find it. Front of the book according to the categories. Okay? All right. It is now 4:30. Do y'all have any questions for me? You can type it in on the live chat right here. I see NC Worker. She's supposed to be texting me. I gave her my text number. If you all have any other questions, let me get a blank sheet of paper. Okay, you can contact me here. 281-723-4762. Uh-oh, got the 2. You can text me. And when you do text me your full name and how did you find out about me, through my YouTube, maybe through the advertisement on my van. I do have advertisement on my van. And then here's my email. When you email me, that's thcod@hotmail.com. When you do it, put on there YouTube interest or Tamika, YouTube, something to that nature. And then I'll respond back to you appropriately. Okay. All right. Well, if y'all don't have anything else for me, I'll be signing off. Miss T, it was nice having you on the line here.
It was nice learning.
Yes, I enjoy teaching. I love what I do. I do. And I will see.
You're actually a great teacher.
Thank you, honey bun. I appreciate that. I appreciate that very much. So I will see y'all on the same bat channel, same bat time, 2:00 Houston time on YouTube, and the same for you, Miss T.
All right. Thank you, Miss Harper. I appreciate it.
All right. Love you much.
I love you too.
Okay. Bye, y'all.
All righty. Bye-bye.